is Roger Green, host of the Surfing the NASH Tsunami podcast. This week, we are offering 4 conversations from episode 2, our discussion with leading patient advocates, plus from the vault, a conversation from March 2023 with Jeff McIntyre about the value of NASH medications. I start this conversation talking about the logic and dynamics of price-volume trade-offs. The dynamics may change a bit based on disease severity or size of population, but in most countries, most of the time, the budget for a medication is set within a range, which means that the higher the price is, the fewer patients will receive it. I then ask the advocates whether and how they've been involved in access decisions to date. The short answer is they haven't. To Tony Villiotti, whose NASH knowledge focuses on patient education and communication, this falls beyond the organization's remit. It is closer to the remit of Wayne Eskridge's Fatty Liver Foundation and dead on target for the Global Liver Institute. But neither Wayne nor Jeff McIntyre have been involved in any such discussion. Milan Mishkovikj of ELPA states that he and his colleagues will be looking at the U.S. and working to learn by example in setting strategy and communicating with legislatures and officials in the European Parliament in Brussels. One important factor for Milan, elections are coming in June of this year. Louise Campbell notes that in the UK at least, private insurers will likely have significant impact, although everything starts with NICE. This conversation yields 3 common themes. The guarded optimism of the patient advocates as they await the Resmetirom PDUFA date, their desire to be included in discussions about patient access and value, and finally, the different kinds of exciting work and programs each sees on the agenda for 2024. I always find our episodes with advocates to be equal parts energizing and thought-provoking, so just sit back, listen, learn, enjoy. When you're done, join the dialogue in our LinkedIn discussion group.
Jeff McIntyre.
If we're only focused on this one component, we have to be planning for the second half while we're playing the first half on this. And there's some important questions still that are going to remain when the 14th comes around labeling, around plans for coding, all these sort of things that I think are going to be really, really important as we continue to move forward.
Roger Green.
And then you get the price-volume trade-offs and all kinds of other issues. A lot of the folks that I speak with who are either professionals or tied up with payer community are terribly intrigued about how you trade off price for volume. Well, those aren't the words that people use necessarily, in the States at least. But, outside the States, it's a very, very clear deal. You get a budget line, and if your price is X, then that's going to dictate how many patients you get because the budget line just isn't going to move. Here, it's not that fixed. But I think we all learned from Hep C that you can make the system work that way if you want. In the States, they certainly made the system work that way. Every time the price halved, the patient load doubled. So it'll be interesting, Jeff, to see how all that plays out. Where do you, to Jeff, I guess, and Tony and Wayne also, in the States, where do you see those issues getting mediated? I mean, are they going to be through the patient advocacy organizations? Are the professional communities going to play a role in that? Or, and what kind of support is there going to be around access, and where's it going to come from, do you think?
Well, you ask easy questions, don't you, Roger? Tony and Wayne may have a different impression on this, but my understanding is that there has been some conversations with the professional organizations. However, as patient groups, we have been largely blocked out of those conversations. There was an interagency meeting on the 24th of last month, I believe it was, that we asked repeatedly for patients to be involved in so we can be informed and help drive the conversation around patient access. And universally, we were told not to be a part of that meeting. And so I can't speak for the professional societies anywhere beyond that in terms of what their involvement is. We've gotten reassurances that there are things that are happening. That said, as a patient organization, we're not waiting for them. And so we're going to drive those conversations with the payers. We're going to make sure they hear from us. We're going to make sure that we are in communication with all the important stakeholders here on this and take it under our wing to make these things happen.
Tony, Wayne, are there issues that your organizations are working with around supporting patients and getting access to medication? Well, A, access just to prescribers, and then B, access to reimbursement.
Tony Villiotti.
Yeah, just echo what Jeff said. We have not been asked or been invited to participate in any of those kinds of discussions. So our approach has been to kind of take a wait and see approach. Obviously, it's an issue that needs to be addressed. And I'm not sure that our little organization is best positioned to drive any of those conversations, but we're anxious to be involved.
Wayne Eskridge.
We kind of sit in between Tony and Jeff. We have some involvement with those particular issues. GLI is very much at the system interface. They function, at the policy and rules area far more than we do. We have some contact with that. We have some advisory roles with some of the pharmaceuticals. We're participants in some working groups. But in terms of real access to to the policy and decision makers, we don't really have much opportunity to do that. It's very difficult, as Jeff says, to have an influence from a patient perspective at this point in the game, which is sad, but it is a fact, and it really is.
Yeah, I understand that, and everybody's nodding. So to Milan, I guess, or to Louise, when you look at the U.S. around access questions, what are you hoping to learn that will help you in your countries? And I guess ELPA, because you work a lot with Brussels, you certainly have some significant government involvement on an ongoing basis. What will you be looking to learn?
Tony Villiotti.
In the moment, we are learning between us a lot, I think, because we already make different approaches to the policy decision makers in Brussels about this issue. And together with all our stakeholders on our, let's say, events, which was made in Brussels, was part JLI and some other main stakeholders from Europe. And we try to already to touch the subject that what is coming in the future and what kind of changes need to be done, particularly in this area. And I think the good collaboration between us and Global Liver Institute, especially these 2 years. We already somehow announced the coming of the new drugs about this, and we connected like one of the most important risk factors for reducing the liver cancer. One of the things. The second part was that connection with the obesity, where we trying to divide it on the both different sides, like awareness prevention obesity and awareness prevention for liver cancer. In the moment that was going through the lifestyle and different physical activities, but also that how the new research coming on the table, it's coming a new hope for the patient where much faster and much easier can resolve the situation of this group of patients. We have some kind of acceptance, let's say, and the experience from USA, which every time I'm so grateful to JLI that every time they're contributing on our events, sharing all the necessary details about what is the situation in USA, how they're struggling with all of these challenges, what are on the table, giving to the European policy decision makers to see that in Europe, how need to proceed or how to do these changes and to be more acceptable for them. And this is the structure which we're trying to make for the next period. For that, the past 2 years, we have so many events and everything was somehow connected with myself to be understood among the politicians, especially who are the groups, why is this silent epidemic ongoing in the moment, who are the factors and what will be needed to be done in the next period, how to reduce this. And already through the EU Council Meeting Plan has different roadmaps which are giving some kind of perspective for us where we can push it like a target, because we excellent managed to find a way how to push, let's say, hepatitis in these roadmaps, like a prevention through the medicaments, vaccination, all of these things. And now it's coming the MASH and MASL, which I think we have a strong added together with our partners, with you guys in USA, more comprehensive way to unite our voices and to share our experience, especially in how we are reaching our, let's say, main stakeholders to do a different kind of accessing of what next steps need to be done in this field. I think Europe, it's more and less policy decision makers are prepared. Also, it's coming the new election for June this year. We already, like European Liver Patient Association, working on, let's say, our advocacy work with the new members of the parliament and the new structure which are coming. And we're working especially very closely with some of the bodies. How ELPA is involved in different committees and groups and agencies like EMA, like HERA, and all of these important stakeholders for us, which they need to provide us with, let's say, somehow acceptance of our challenge, which is coming in the moment. And that from that perspective, with the help from USA, which is very important to be heard what is going on, and because it's going to be the first country. I think with Jeff, with Wayne, with you, Roger, with all of you together, you will constantly inform, and this is going to be one more excellent approach for us how to proceed this very relevant campaign, which is still ongoing in the moment in Europe. A lot of different stakeholders, which we are working in the health, which we have some kind of, I will say, alliance for EU for Health alliance, which is providing us different opportunities to react in the moment. We have one issue in the moment, which I will tell you. In the last summit, which was before 1 or 2 weeks in Brussels, happened something unexpected for us in the health community. 1 billion euros was cut from this program. We're trying to change this perspective in the next period. We hope so that it's going to be accepted, our remarks and everything what we are doing with our main stakeholders in Europe to change that. But in every case, we have a good situation in the moment because the ENVI Committee for Health and Food Safety, non-communicable disease also, a report which was out, was already somehow speaking about this issue. And we managed to make some structures around that are prepared, and they will make more efforts who will change this. But we are not alone, I must be honest. We have so many partners in this fight, and giving slowly, but giving some kind of results. It's going to be difficult, definitely. I agree with Jeff. Even our structure is a lot different from USA, but possibilities are here. But I will not be so, let's say, optimistic, because we know what happened with hepatitis, and I still will keep that optimism somehow in the middle to prepare a better field in the next period. But thank you, Roger, and thank all of you today and the next, let's say, interviews and everything what is going to be connected with this issue will bring somehow more strength to all of us and different experience moments which we can share in every moment. This is for me, let's say, somehow beneficiary, not just for me, but for all our members in Europe.
That's great, Milan, and thank you for that. Louise, you have questions you want to ask folks before we go on to next, whatever the next?
Louise Campbell.
Well, I think it comes down for me to know what the payers are going to do. And I think Jeff alluded to this along with Tony and Wayne. This is also going to be an issue in Europe. Medical insurance companies have a large role to play in this. And I haven't really currently seen them recognize MASLD, MAFLD, MASH, NASH around the world as something they've really been interested in. But they are suddenly going to find that a large number of their members may well need this medication. But also the positive of that, of potentially making insurance companies drive education, early screening. How do you see that sort of thing working? Because I think we will learn a lot from that in Europe. NICE are going to have to approve this medication depending on cost. So not only have we the EMA, we've got the individual countries' approval, but I think insurers have a massive role to play in this. And I just wondered how you guys saw that playing out.
I will add something on the Louise comment. We have a diversity, big diversity. I agree with you. And we have 2 levels of approvals, the national levels and EMA. But also in the same time, we have through this, let's say, initiative through European Commission and the Parliament, which are trying to let's say, this recommendation, which are coming on. This is also a strong weapon for us, because if they accept it, and this is much easier after that to be disseminated to the member states. Because if you have on the main level, even it is a recommendation, it is not mandatory for them, but it's much easier that somebody accept that and somebody know about that. And after that, very, very easy, you can smoothly with the national members remind them that this exists, that this is a problem, and we have a lot of patients in particular countries, and that we need to be sell down, and somehow to get this access much easier than these roadmaps really are helpful in many different fields which they provide us. And I think if it's also for MASH, we will have much easier success, I think. For that, we're trying to do it on the European, on the highest level in Europe, first of all, together with the approval from EMA. After that, much easier when you have approval from EMA and you have some kind of roadmap, which is a recommendation for the member states. I think these both tools is somehow like a weapon for us to use on the national level for easier acceptance.
And now, back to Roger.
We hope you've enjoyed this recording. If you have any questions or comments about the content of this conversation or the entire episode, please put them in the review section of the page from which you downloaded this conversation, or send an email to questions@surfingmash.com. We'll be back next week with some of the leaders of the nomenclature process to discuss its successes, lessons, and next steps. Until then, stay safe, surf on. We'll see you on the podcast. Bye-bye now.